The Medicare Competitive Bidding Program for Home Medical Equipment, or HME, was intended to save taxpayer money without impacting access to HME. Auctions were held in large cities, excluding over 75% of suppliers who provide HME, while significantly reducing rates. In 2016, the program expanded nationwide into rural and non-bid America, slashing reimbursement for vital HME by upwards of 50 to 80%. CMS continues to deny that this has negatively impacted beneficiary access to care. Healthcare professionals who attended the annual Handy Medical Supply Conference were asked what effects competitive bidding is having on their patients. This is what they shared.
We do pulmonary rehab, and so speaking from an oxygen perspective, when the competitive bid picture is in place, what I see is obviously narrow companies to choose from for those who are straight Medicare, and the amount of patients influxing into that narrow pathway. It's just the service that can be provided from those few companies can't meet the demand that's being there.
It's very frustrating, and it's very hard to get the equipment that patients need in order to be discharged from the hospital or to be cared for at home.
They don't get their equipment delivered to them in a timely manner, or there's less options of equipment that will meet their needs for their home use, and they do end up back in the emergency room and admitted because it was 2 days later before their oxygen was delivered.
You know, people are going weeks and weeks without oxygen. Wow. You can't go weeks without oxygen and survive.
I don't think it's unusual for somebody waiting 2 to 3 months just for a manual wheelchair.
Yeah, just not getting what they need, probably declining, probably falling, probably ending up back in the hospital.
So they do on their own go out and they spend $3,000–$4,000 on a POC off the internet or from California or whatever, and it does not meet their needs, it's not returnable, and it's devastating.
That continuity of care we recognize in healthcare with our medical providers, our primary providers, our therapists, our other providers is really critical because people get to know you and they understand you, and you save time and money because you know what the next thing is, and it's destroying not just access to care but quality of care. I think that the public policy folks really need to pay attention because we're touting savings, but I can, in my gut and in my head, those are cost shifts. Those are cost shifts, like we've heard today, to the healthcare industry. Those are cost shifts to personal and family resources, and they need to be digging into the data and looking for the cost shifts because I can guarantee they aren't saving any money.
The government is picking on the most vulnerable people in our population.
It may be great for Medicare, it's not great for the patients. It is the worst thing that I've ever seen in my entire life, and I've been in this industry since 1972.